Hi, I'm Ryan.
And I'm Terry.
And we are with Smiles on Wheels. We have partnered with the Delta Dental Foundation for the Serving Smiles to Seniors project. We are going to be talking to you today about oral hygiene care and nutrition. The first thing we are going to talk about is proper toothbrushing technique. When you're brushing your teeth, you want to make sure to brush the smile line of your teeth, or the outsides of your teeth, the tops of your teeth where you chew your food, and the insides of your teeth. You also want to make sure that you are using the right angle to get down at the gum line to brush. That is where a lot of the plaque and bacteria like to hide.
Here is a picture demonstration on proper toothbrushing. Notice the toothbrush is angled at 45 degrees to get along the gum line. Remember to use short strokes and light pressure with the toothbrush when you are brushing to avoid gum recession.
When picking out a toothbrush, you want to make sure you choose one with soft bristles. You want to avoid the toothbrushes with medium to hard bristles because those will end up doing damage to your gums in the long run. When you are brushing your teeth, you also want to make sure you are using light pressure with your toothbrush. When choosing a toothpaste, you want to pick one that has fluoride in it. The fluoride is going to help protect your teeth against cavities.
A good rule of thumb is to replace your toothbrush every 3 to 4 months, especially after you've been sick or once the bristles start to fray. If your bristles have started to fray, it's because your toothbrush needs to be replaced or you are applying too much pressure to your gums.
If you are having trouble holding onto your toothbrush due to dexterity issues, maybe from arthritis or having a stroke, we have some alternatives for you. These are adapters that your toothbrush just slides right into, making for a bigger handle to hold, and it makes it a lot longer to be able to get to the back teeth. There are also bigger ones to help with dexterity, and these are called Grip Ease. You can purchase these online.
If ordering online isn't an option, there are also some household items you can use as well. You can take a washcloth and wrap it around your toothbrush and secure it with a couple rubber bands, or you can use duct tape as well. Another option would be to have someone cut a slit into a tennis ball for you. You'll just insert your toothbrush and this will allow easier gripping for easier brushing.
Another area in the mouth that we need to make sure to keep clean is the tongue. The tongue has a lot of papilla on it that attract a lot of bacteria and food. By cleaning the tongue, you are improving your breath, improving your taste, and avoiding that bacteria that's on the tongue from getting back into your body when you swallow. You can use a tongue scraper to clean your tongue. With this, you want to start at the back of the tongue and move forward all the way across the tongue. And then you can just rinse this off when you're done. If you don't have a tongue scraper, you can just use your regular toothbrush when you're brushing your teeth and make sure that you're cleaning off your tongue really well.
Oral cancer is a serious problem that affects older people. Your risks increase with cigarette use, cigars, or chewing tobacco. That's why we recommend that you see a dentist at least once a year, whether you have teeth or no teeth. We want you to be your own advocate and do your own oral cancer screening.
We want you to be checking for any lumps, bumps, or sores that are not normally present in your mouth. These can be located anywhere in the mouth, on the cheeks, lips, tongue, roof of the mouth. If these lumps, bumps, and sores aren't gone within 2 weeks, we highly recommend seeing your dentist or doctor because early detection is always best. That is also why we recommend taking your partial or your denture out every night so you can take a peek in your mouth and make sure nothing is going on.
Another oral issue that occurs more frequently in older adults is dry mouth. If you have dry mouth, you're not alone. Over 400 medicines cause dry mouth. Also, as we age, our saliva glands don't produce as much saliva, which causes dry mouth and increases our risk of cavities because we don't have saliva to wash away the sugars.
Here are some examples of products that you can use for dry mouth. Your best bet is going to be drinking lots of water to help moisten your mouth. There are also dry mouth rinses such as Act or Biotin that will help moisten your mouth throughout the day. If you like using candies, gum, mints, or cough drops to help moisten your mouth, make sure that you are getting a product that is sugar-free. You do not want to have that sugar sitting in your mouth all day and increasing your risk of cavities.
Here's a representation of root decay. Root decay occurs when the root surfaces of the teeth are exposed and not protected by the gums. Root surfaces are softer than the tooth enamel and may be more likely to have problems. This is because of a few reasons. The root surfaces are harder to keep clean, and many older adults take a list of medications that cause dry mouth, so there is a lack of saliva to wash away the bacteria of these surfaces. For these reasons, the root decay is very easy.
The health of your mouth affects the health of the rest of your body. The mouth is the gateway to your body, so issues with your oral health may lead to problems in your overall health. Signs of bleeding gums or increased tooth decay may indicate there are other health issues going on in the body. If you have diabetes or any other chronic diseases, be mindful that you may be at higher risk of mouth problems like mouth sores, yeast infections, gum disease, tooth loss, burning, or dry mouth. However, as long as you keep a clean mouth, these health issues can be controlled and maintained.
I'm sure you have seen this before, but if you have not, this has taken place of the food pyramid. The My Plate is a better visual of how we should be mindful of what and how much we are eating. We want to make sure that half of our plate is fruits and vegetables. The more color, the better. Look for food and drink choices that are low in saturated fat, sodium, and added sugar.
Here is a visual representation of the hidden sugars found in our drink choices. Water is obviously the best option since it contains no sugar. Other drink choices such as juice, sports drinks, and pop may contain 5 to 19 teaspoons of sugar. That is a lot of sugar for one beverage. If you consume these sugary drinks, we recommend that you consume it all at once, preferably with a meal. We don't want you sipping on these drinks all day long. When you drink a sugary beverage, the sugar it contains interacts with the bacteria in your mouth to form an acid. That acid attacks your teeth. With each swig of a drink, the acid attack lasts 20 minutes. So if you sip these drinks all day, your teeth are under constant attack. So we need to try to be mindful of our drink choices.
Thank you for joining us today for our presentation on oral health and nutrition.